Well, we are in the middle of Breast Cancer Awareness Month, a time to underscore the importance of spreading the word about symptoms and ways you can check for warning signs. The Wellness Plan Medical Centers in Metro Detroit are doing just that. And joining us this morning, Dr. Lemitri Lockhart and Dr. Sharon Miller, both OBGYNs. Ladies, thanks for coming in this morning.
Thank you very much.
So, Dr. Lockhart, first of all, tell us about the Wellness Plan Medical Centers, what it is that you guys do exactly.
Well, the Wellness Plan Medical Center is a federally qualified health center that focuses on caring for the uninsured and the underinsured. However, we see everyone. And so primarily we want to focus on the underrepresented population.
Gotcha. And doctor, how often do you see patients who come in who may have had warning signs but just weren't aware of them?
Well, I think that's important to mention because if there are changes in the breast, if there's nipple discharge, for example, or the nipple starts to retract, or there's redness, or there's pain, there's a lump, then those are the warning signs, and we would want you to present to your OBGYN at the Wellness Plan or your clinic.
And Dr. Lockhart, we often hear about the ages for mammograms. What do we need to know about what age we should get a mammogram?
Well, the standard currently is for patients at average risk to start getting mammograms at age 40. However, there are patients that have higher risk, family history or various things. And actually for the African American population, there's new recommendations that we should actually start getting the baseline mammogram slightly earlier. So I start around 35 to 37 with their baseline mammogram.
And we also hear often too that for some people who have dense breast tissue that it can be really hard to actually detect. What should someone do if that's what their doctor tells them that they found after a mammogram?
Well, now they have the 3D mammogram and they also have MRI. Those modalities allow to see through the dense breast. Also, we still recommend breast exam, clinical breast exam by the physician, and also self-breast exam by the patient.
And I know you touched on family history. I was telling you ladies a few weeks ago I did a story with two women who were talking about how important knowing your family history is, because if you know that, then you can potentially know if you're at risk or even have the BRCA1 or the BRCA2 gene, correct?
True, definitely. It's, you know, the family history I think is hugely important. And a lot of times patients just aren't aware if their mother, their grandmother, their aunts had breast cancer. So I think it's important that we get that history while people are living and follow up on those things.
And so for people who are watching, what kind of warning signs, symptoms, what should we be looking for?
Well, one of the main things we like to focus on is self-breast awareness. That essentially is knowing what your breasts normally feel like. So if during your self-breast exam you happen to feel a lump, a mass, or anything of the sort, you should immediately contact your physician. But also, when you do your self-breast exam, you have to make sure you squeeze the nipple. White or clear is within normal range, but if you ever see blood, you should contact someone immediately.
Okay, and Dr. Miller, your locations, you've got them all around Metro Detroit, right?
We do. We have 3 offices in the Detroit area and an office in the Pontiac area. We're down in the Mid-Center area, Grand Boulevard and the Lodge. We're on the east side, and we're also on the northwest side at 8 in Greenfield. So we have many offices. We're available. We do see walk-in patients. We see scheduled appointments. We're there for patients who need to get in urgently, immediately. If they have a concern, they just have to call or they can walk in, and we're happy to see them.
Well, we appreciate all that you do for the community, and thank you for helping spread this important message. We'll be right back. Stay with us.